What are some conditions where IVF is a good treatment option for you? In vitro fertilization, or IVF, is an assisted reproductive technique in which fertilization, or the meeting of the egg and the sperm, takes place outside the body in a lab, and the resulting embryo is then transferred back into the uterus. Some common indications for IVF are if there is a blockage or damage to the fallopian tubes. This can inhibit the movement of the eggs from the ovaries to the uterus, and it can also inhibit the movement of the fertilized egg as it makes its way to the uterus for implantation. Number 2, endometriosis. This is when tissue that's similar to the lining of the uterus is found outside the uterus. It can affect the ovaries, the fallopian tubes, or the surface of the uterus. Number 3, fibroids, especially larger fibroids, can inhibit the movement of the sperm as they swim up to reach the egg, and also the movement of the embryo after fertilization. Number 4, a previous tubal ligation surgery, where the tubes are tied as a birth control method. Number 5, certain ovarian conditions that can cause irregular ovulation or an absence of ovulation, such as PCOS. Number 6, male factor infertility, whether it's issues with a low sperm count, with poor sperm motility, or an abnormal sperm shape, or something else. Number 7, when parents suffer from certain genetic conditions that can be passed on to the baby. In such cases, IVF with preimplantation genetic testing can be useful. In this, after the eggs are fertilized, embryos are examined to look for any genetic abnormalities. Of course, not all abnormalities can be diagnosed on this testing, but embryos that are found to be the healthiest are chosen for transfer back to the uterus. And lastly, where fertility needs to be preserved due to certain health conditions such as cancer. In these cases, the embryos that are formed can be frozen for later use.